Hello, my name is Nathan Aragones, and today I will be convincing you to take up the stance that the United States should have national health care. I have three main reasons behind this stance. The first is the cost. The United States spends simply too much on health care. Secondly, the extreme commercialization of healthcare. It becomes more about monetary gains for corporations than the overall health of citizens within the nation. And third is how other nations that have employed systems of national healthcare have experienced large amounts of success and how the US ignores them and refuses to change to their systems. Firstly is the price. In an article by MIT Medical, we are shown that the United States spends an astronomical amount on healthcare. It costs $7,500 for a broken leg, $30,000 for a 3-night hospital stay. These prices are simply too much. And there's a variation of prices within the United States. A blood test in Baltimore would cost $22 to $37, while in El Paso, Texas, it would cost $144 to $952. This price variation is one of the core reasons that plagues the United States healthcare system. In addition to price variations, there is an, an inaccessibility to get healthcare treatment. We are already paying an astronomical amount, but for a non-emergency appointment, you will be waiting months and months to get to your appointment. And in an emergency situation, that wait, though it will be much shorter, could potentially be lethal for the patient. Why is it that we pay so much for healthcare if it's not even readily accessible? Secondly, is the extreme commercialization and unbridled commercialization of healthcare in the United States. In an article from Hindawi Biomed International, there's a survey conducted on, between citizens of the United States and similar nations. Here it is shown that the United States citizens are marginally unhappier with how their healthcare system functions due to the expenses and the complications that arise from healthcare providers. In here, we find that not only is healthcare out of pocket expenses correlable with satisfaction with the government, but also with overall life satisfaction. And insurance companies will lure you in with the promise of a plan that will be assigned to you depending on what you are needed, but you are stuck with a one size fits all plan that just broadly handles your needs. Secondly, in an article from the Public Library of Medicine, we are shown a side by side comparison of the United States to other countries such as United Kingdom and Canada. Here we see that we spend 2 times more than these countries, and yet we have these facts. We rank 21st in overall healthcare, 43rd in life expectancy. We have a 6.1 infant mortality rate, and out of high income nations, we rank 22nd out of 27. Why are we spending so much more if we are on the same level, if not worse, than other high income nations? And finally, my third point is that the United States re- does not acknowledge the success that other nations have had with systems of national health care. For example, in Sweden, during the COVID-19 pandemic, infrastructure throughout the world collapsed. But due to Sweden's system of national health care, they were able to quickly bounce back from this, and they were able to have universal solutions due to their system of national health care. Something like this would not be possible in the United States due to insurance complications with pricing and billings. But here it was all about the people, and they were able to serve the people and get the people the solutions they needed and the care they needed. Secondly, in Pauline Lockhart's analysis of Denmark and New Zealand, they are having next gen solutions in 2008. In 2008, they were already starting to use intelligence technology for patient records and making accessibility easier for healthcare workers. Here, using the easy accessibility, they were able to get patients the treatment they needed much, much faster than even in 2008. And now these countries are working to create a better healthcare future for not only themselves but for the world. To resurmise, the a system of national healthcare would serve Americans for the better and would allow them to relegate the expenses that they spend on healthcare to other aspects of their lives. I've covered the costs which are simply too high for healthcare in the United States, the commercialization of healthcare, which is unacceptable as it commercializes a humanitarian industry, and thirdly, the success that other nations have had with healthcare and how implementing this system would greatly improve the United States' system of life. The United States is built on ideas from countries. Why is this not something else that we can adopt? Thank you for your time.